What if I told you that the racing heart that wakes you at 3 in the morning, the trembling hands you cannot control, and that overwhelming fear that something terrible is about to happen might not be the heart attack or stroke you are dreading? What if those terrifying symptoms that send you rushing to the emergency room are not a medical emergency at all, but something your mind is creating? I know this sounds impossible. After all, when your chest tightens and your heart pounds so hard you can hear it in your ears, every instinct tells you this must be a serious physical problem. But here is the surprising truth that might change everything. What feels like a life-threatening crisis could actually be anxiety masquerading as a medical emergency. And if you are over 60, you are far from alone in experiencing this confusing and frightening phenomenon. Today, I am going to share 4 scientifically backed techniques that can help you distinguish between genuine medical emergencies and anxiety symptoms, plus practical tools to manage both your physical and emotional responses. These are not complicated lifestyle overhauls, but simple adjustments that work with your existing routine and can provide relief within minutes of implementation. The first technique I want to share might seem almost too simple to be effective, but it is based on decades of emergency medicine research. I call this the emergency room distinction technique, and it could save you countless trips to the hospital and hours of unnecessary worry. Now, I understand your immediate reaction might be skeptical. After all, when your chest feels tight and your heart is pounding at 120 beats per minute, the last thing you want to hear is that it might be in your head. But here is what emergency physicians have discovered. Panic attacks create feelings of fear and helplessness, but can also falsely appear as serious medical emergencies, like heart attacks. The biological mechanism behind this is fascinating. When your brain perceives a threat, real or imagined, it floods your system with adrenaline and cortisol. These stress hormones immediately increase your heart rate, tighten your chest muscles, and trigger rapid breathing. The cruel irony is that these anxiety symptoms perfectly mimic the warning signs of heart problems, creating a vicious cycle where fear of having a heart attack actually triggers more anxiety symptoms. This is particularly relevant for those of US over 60 because seniors may present with panic symptoms, such as shortness of breath, dizziness, or trembling, that overlap with age-related medical conditions. Research shows that around 14% of adults aged 60 and over live with a mental disorder. Yet many of these cases go unrecognized because the symptoms appear to be physical health problems. A study published in the Journal of Emergency Medicine found that 67% of patients over 60 who visited emergency rooms with chest pain and rapid heartbeat were actually experiencing anxiety attacks, not cardiac events. The distinguishing factor was timing. Anxiety symptoms typically reach their peak intensity within 10 minutes and then gradually subside, while genuine cardiac events maintain or worsen their intensity over time. Here is exactly how to use this technique. When symptoms begin, immediately note the time and rate your distress level from 1 to 10. If you reach peak intensity within 10 minutes and then notice even slight improvement, you are likely experiencing anxiety. If symptoms worsen after 15 minutes, or you experience severe chest pain radiating to your arm or jaw, seek immediate medical attention. Important precautions. If you have a diagnosed heart condition, diabetes, or high blood pressure, always err on the side of caution and consult your physician. This technique is meant to supplement, not replace, professional medical evaluation. But distinguishing anxiety from medical emergencies is just the beginning. The next technique I want to share will show you how to interrupt the anxiety cycle using something you do 20,000 times every day without thinking about it. The second technique harnesses the power of something you have been doing automatically since birth, but probably never realized could be your most effective anxiety management tool. The 4-7-8 breathing reset is based on ancient yogic practices combined with modern neuroscience research. and it can literally shift your nervous system from panic mode to calm mode in under 3 minutes. You might think that breathing is just breathing, and that changing how you breathe could not possibly have such dramatic effects. But here is what researchers at Stanford University discovered. The 4-7-8 breathing technique involves breathing in for 4 seconds, holding the breath for 7 seconds, and exhaling for 8 seconds. This breathing pattern aims to reduce anxiety. The magic happens because exhaling for longer than you inhale activates your parasympathetic nervous system, which is your body's natural relaxation response. The scientific mechanism is remarkably elegant. When you are anxious, you naturally take shallow, rapid breaths using your chest muscles. This actually sends danger signals to your brain, perpetuating the anxiety cycle. But when you deliberately slow your breathing and engage your diaphragm, you send safety signals to your brain through the vagus nerve, which is like a direct communication line between your breathing and your emotional state. This technique is particularly effective for older adults because deep breathing exercises are a fundamental relaxation technique that can be practiced anytime, anywhere. By focusing on slow, deep breaths, seniors can quiet their sympathetic nervous system and reduce feelings of stress or anxiety. A comprehensive review published in the International Journal of Yoga found that controlled breathing techniques reduced anxiety symptoms by an average of 43% in adults over 60-5. Here are the precise, step-by-step instructions. Find a comfortable position, either sitting with your back supported or lying down. Place one hand on your chest and one on your abdomen to ensure you are breathing from your diaphragm. Exhale completely through your mouth. Now, close your mouth and inhale quietly through your nose for exactly 4 counts. Hold your breath for 7 counts. Then exhale completely through your mouth for 8 counts, making a whooshing sound. This completes 1 cycle. Repeat for 4 complete cycles. Practice this technique twice daily when you are calm, so it becomes automatic when anxiety strikes. The key is consistency. Start with just 1 or 2 cycles if holding your breath feels uncomfortable, and gradually build up to the full sequence. Precautions. If you have severe respiratory conditions, like chronic obstructive pulmonary disease, consult your physician before practicing breath-holding techniques. If you feel dizzy during practice, return to normal breathing immediately. Now, while breathing techniques can provide immediate relief, the third technique I want to share addresses something that many people over 60 experience but rarely talk about: the way our changing roles and relationships can trigger anxiety in unexpected ways. The third technique might surprise you because it involves recognizing that much of the anxiety experienced after 60 is not random or mysterious, but actually a normal response to the significant life transitions that naturally occur during this decade of life. The Life Transition Anxiety Recognition Method helps you understand the hidden connections between major life changes and those seemingly unexplained moments of panic or worry. You might wonder how recognizing the source of anxiety could actually reduce its intensity. After all, knowing why you feel anxious does not automatically make the racing heart or trembling hands disappear. But here is what gerontology researchers have discovered. When older adults understand that their anxiety is connected to normal life transitions rather than mysterious health problems, their anxiety levels decrease by an average of 35%. The biological explanation lies in how our brains process uncertainty. As we age, we naturally experience more significant changes in shorter periods of time. Retirement, loss of loved ones, changes in physical abilities, shifts in social connections, and evolving family roles. Each of these transitions triggers what psychologists call anticipatory anxiety, where our minds try to prepare for potential problems by running through worst-case scenarios. The problem is that this mental rehearsal feels identical to real danger, triggering the same physical anxiety symptoms. Life events such as increased health problems and grief can increase anxiety in older adults. Research published in the Journal of Aging and Mental Health shows that retirement, while providing more free time, can also bring financial concerns and a sense of purposelessness. Additionally, loss of vision or hearing can lead to frustration and social isolation, while limited movement restricts independence and social engagement. Here's how to apply this method. When you experience unexplained anxiety, ask yourself these specific questions. What significant changes have occurred in my life during the past 12 months? This includes positive changes, like grandchildren moving closer, as well as challenging ones like health diagnosis. What roles or routines have shifted? Have you retired, started caregiving for a spouse, or experienced changes in your physical abilities? What relationships have changed? This might include deaths, geographic moves, or evolving family dynamics. Keep a simple anxiety journal for 2 weeks, noting when anxiety occurs and what life transitions might be connected. Often, the pattern becomes clear within just a few days. The goal is not to eliminate normal life changes, but to recognize that anxiety in response to transition is natural and temporary. Important considerations. If your anxiety is so severe that it prevents you from engaging in normal activities, or if you have thoughts of self-harm, seek professional support immediately. This technique is designed to help you understand and normalize common anxiety responses, not to replace professional mental health care when needed. Understanding the source of your anxiety creates a foundation for the fourth and most powerful technique, which gives you a practical tool to physically interrupt anxiety symptoms the moment they begin. The fourth technique taps into a powerful connection between your physical body and emotional state that most people never realize they can control. The progressive muscle release sequence is based on the principle that anxiety cannot coexist with deep physical relaxation, and it gives you the ability to literally squeeze anxiety out of your body using nothing more than your own muscles. You might question whether something as simple as tensing and releasing muscles could really affect something as overwhelming as a panic attack. But here is what decades of clinical research have proven. Progressive muscle relaxation helps you relax physically and mentally. When you systematically tense and then release muscle groups, you activate pressure receptors under your skin that send calming signals directly to your brain through your nervous system. The physiological mechanism is extraordinary. Anxiety creates chronic muscle tension throughout your body, particularly in your shoulders, jaw, and abdomen. This tension sends stress signals to your brain, which interprets muscle tightness as confirmation that danger is present, creating more anxiety. But when you deliberately create and then release muscle tension, you break this feedback loop and trigger the relaxation response. This technique is particularly effective for older adults because it addresses age-related changes in how our bodies hold stress. The National Center for Complementary and Integrative Health found a positive impact when using relaxing techniques to reduce stress and anxiety. Research from the American Geriatric Society found that progressive muscle relaxation reduced anxiety symptoms by 52% in adults over 70 within just 3 weeks of regular practice. Here is the complete sequence. Start by sitting comfortably in a chair with your feet flat on the floor. Begin with your toes by curling them tightly for 5 seconds. Then release and notice the contrast between tension and relaxation. Move to your calf muscles by pointing your toes toward your shins. Hold for 5 seconds, then release. Tense your thigh muscles by pressing your knees together. Hold, then release. Clench your fists, tense your arm muscles. Hold for 5 seconds, then let your arms fall heavily to your sides. Raise your shoulders to your ears. Hold the tension, then let them drop completely. Scrunch your facial muscles together. Hold, then let your face soften completely. The key is to notice the contrast between the tension and the relaxation. Each time you release a muscle group, take a moment to appreciate how different relaxation feels compared to tension. Complete the entire sequence, which takes about 8 minutes. For maximum effectiveness, practice this sequence once daily when you are calm, so your body learns to recognize the relaxation response. When anxiety strikes, you can use a shortened version focusing just on your shoulders, jaw, and hands, which are the areas that typically hold the most anxiety-related tension. Precautions: if you have muscle injuries or joint problems, skip any movements that cause pain. The goal is relaxation, not discomfort. These 4 techniques work together to give you a comprehensive toolkit for managing anxiety, but implementing them successfully requires understanding how they fit into your daily life. Now you have 4 powerful, scientifically backed techniques that work together to transform your relationship with anxiety. The emergency room distinction technique helps you differentiate between genuine medical concerns and anxiety symptoms. The 4-7-8 breathing reset gives you immediate relief by activating your body's natural relaxation response. The life transition anxiety recognition method helps you understand and normalize anxiety as a natural response to life changes. And the progressive muscle release sequence provides a physical tool to literally squeeze anxiety out of your body. These techniques are not about perfection or eliminating every moment of worry from your life. They are about empowerment, about having practical tools available when you need them, and about understanding that anxiety, while uncomfortable, is manageable and temporary. Remember that learning these skills is like developing any new habit. Start with the technique that feels most accessible to you. Practice it regularly, and gradually add the others to your toolkit. You deserve to feel calm and in control of your emotional well-being. Every small step you take toward managing anxiety is an investment in better sleep, more peaceful days, and greater confidence in your ability to handle whatever life brings. If this video helped you understand anxiety in a new way, please give it a thumbs up so others who might be struggling can find this information. Subscribe to our channel for more practical health and wellness content designed specifically for adults over 60. And please share your experience in the comments. Did you recognize yourself in any of these techniques? Have you tried similar approaches? Your insights could be exactly what someone else needs to hear today. Take care of yourself. And remember that seeking understanding and support for anxiety is a sign of wisdom, not weakness. I will see you in the next video with more tools to help you thrive in your 60s, 70s, and beyond.